Today we're gonna talk about heart failure. Heart failure, often referred to as congestive heart failure, occurs when the heart is unable to pump sufficiently to maintain blood flow to meet the body's needs. The term chronic heart failure or congestive cardiac failure are often used interchangeably with congestive heart failure signs and symptoms. Commonly include shortness of breath, excessive tiredness, and leg swelling. The shortness of breath is usually worse with exercise, with lying down, and may wake the person at night. A limited ability to exercise is also a common feature. Common causes of heart failure include coronary artery disease, including a previous myocardial infarction, high blood pressure, atrial fibrillation, valvular heart disease, excess alcohol use, infection, and cardiomyopathy of an unknown cause. These cause heart failure by changing either the structure or the functioning of the heart. There are two main types of heart failure: heart failure due to left ventricular dysfunction and heart failure with normal ejection fraction, depending on if the ability of the left ventricle to contract is affected or the heart's ability to relax. The severity of disease is usually graded by the degree of problems with exercise. Heart failure is not the same as myocardial infarction, in which part of the heart muscle dies, or cardiac arrest, in which blood flow stops altogether. Other diseases that may have symptoms similar to heart failure include obesity, kidney failure, liver problems, anemia, and thyroid disease. The condition is diagnosed based on the history of the symptoms and a physical examination with confirmation by echocardiography, blood tests, electrocardiography, and chest radiography may be useful to determine the underlying cause. Treatment depends on the severity and cause of the disease. In people with chronic stable mild heart failure, treatment commonly consists of lifestyle modifications such as stopping smoking, physical exercise, and dietary changes, as well as medications. In those with heart failure due to left ventricular dysfunction, angiotensin-converting enzyme inhibitors or angiotensin receptor blockers along with beta blockers are recommended. For those with severe disease, aldosterone antagonists or hydralazine with a nitrate may be used. Diuretics are useful for preventing fluid retention. Sometimes, depending on the cause, an implanted device such as pacemaker or an implantable cardiac defibrillator may be recommended. In some moderate or severe cases, cardiac resynchronization therapy (CRT) may be suggested, or cardiac contractility modulation may be of benefit. A ventricular assist device or occasionally a heart transplant may be recommended in those with severe disease despite all other measures. Signs and symptoms. Heart failure symptoms are traditionally and somewhat divided into left and right sided, recognizing that the left and right ventricles of the heart supply different proportions of the circulation. However, heart failure is not exclusively background failure. In the part of the circulation in which drains into the ventricle, there are several other exceptions to a simple left-right division of the heart failure symptoms. Additionally, the most common cause of right side heart failure is left side heart failure. The result is that patients commonly present with both sets of signs and symptoms. Left-sided heart failure. The left side of the heart is responsible for receiving oxygen-rich blood from the lungs and pumping it forward to the systemic circulation. The rest of the body, except for the pulmonary circulation, failure of the left side of the heart causes blood to back up, that's to say, be congested into the lungs, causing respiratory symptoms as well as fatigue due to insufficient supply of oxygenated blood. Common respiratory signs are increased rate of breathing and increased work of breathing, non-specific sign of respiratory distress, rales or crackers heard initially in the lung bases, and when severe throughout the lung fields suggest the development of pulmonary edema. Cyanosis, which suggests severe low blood glucose, is a late sign of extremely severe pulmonary edema. Additional signs indicating left ventricular failure include a laterally displaced apex beat, which occurs if the heart is enlarged, and a gallop rhythm. Additional heart sound may be heard as a marker of increased blood flow or increased intracardiac pressure. Heart murmurs may indicate the presence of valvular heart disease, either as a cause, for example, aortic stenosis, or as a result, for example, mitral regurgitation of the heart. Backward failure of the left ventricle causes congestion of the lungs, blood vessels, and so the symptoms are predominantly respiratory in nature. Backward failure can be subdivided into failure of the left atrium and the left ventricle or both within the left circuit. The patient will have dyspnea, that's to say shortness of breath, on exertion and in severe cases dyspnea at rest. Increasing breathlessness on lying flat, called orthopnea, occurs. It's often measured in the number of pillows required to lie comfortably, and in orthopnea, the patient may resort to sleeping while sitting up. Another symptom of heart failure is paroxysmal nocturnal dyspnea, a sudden nighttime attack of severe breathlessness, usually several hours after going to sleep. Easy fatigability and exercise intolerance are also common complaints related to respiratory compromise. Cardiac asthma or wheezes may occur. Compromise of left ventricular forward function may result in symptoms of poor systemic circulation such as dizziness, confusion, and cool extremities at rest. Right-sided failure. Right-sided heart failure is often caused by pulmonary heart disease, cor pulmonale, which is usually caused by the difficulties of pulmonary circulation, such as pulmonary hypertension or pulmonary stenosis. Physical examination may reveal pitting, peripheral edema, ascites, and liver enlargement. Jugular venous pressure is frequently assessed as a marker of fluid status, which may be accentuated by eliciting hepatojugular reflux. If the right ventricular pressure is increased, a parasternal heave may be present, signifying the compensatory increase in contraction strength. Backward failure of the right ventricle leads to congestion of systemic capillaries. This generates excess fluid accumulation in the body, and this causes swelling under the skin as peripheral edema or anasarca, and usually affects the dependent parts of the body, first causing foot and ankle swelling in people who are standing up, and sacral edema in people who are commonly lying down. Nocturia, frequent nightmare urination, may occur when fluid from the legs is returned to the bloodstream while lying down at night. In progressively severe cases, ascites and liver enlargement may develop. Significant liver congestion may result in impaired liver function, congestive hepatopathy, and jaundice and even coagulopathy. Problems of decreased blood clotting may occur. Biventricular failure. Dullness of the lung fields to finger percussion and reduced breath sounds at the bases of the lung may suggest the development of a pleural effusion, though it can occur in isolated left or right-sided heart failure. It's more common in biventricular failure because pleural veins drain into both the systemic and pulmonary venous systems, when unilateral effusions are often right-sided. If a person with failure of one ventricle lives long enough, it will tend to progress to failure of both ventricles. For example, left ventricle failure also allows pulmonary edema and pulmonary hypertension to occur, which increases stress on the right ventricle. Right ventricular failure is not as deleterious to the other side, but neither is it harmless. Causes: congestive heart failure. Heart failure may also occur in situations of high output, termed high output heart failure, where the amount of blood pumped is more than is typical and the heart is unable to keep up. This can occur in overload situations such as blood or serum infusions, kidney diseases, chronic severe anemia, beriberi, vitamin B1 and thiamine deficiency, hyperthyroidism, Paget's disease, arteriovenous fistula, or arteriovenous malformations. Viral infections of the heart can lead to inflammation of the muscular layer of the heart and subsequently contribute to the development of heart failure. Heart failure can predispose a person to develop heart failure later in life and has many causes including systemic viral infections. For example, HIV, chemotherapeutic agents such as daunorubicin and trastuzumab, and abuse of drugs such as alcohol and methamphetamine. Additionally, infiltrative disorders such as amyloidosis, connective tissue disease, and such as systemic lupus erythematosus have similar consequences. Obstructive sleep apnea, which is a condition of sleep where uh, in disordered breathing overlaps with obesity, hypertension, and or diabetes, is regarded as an independent cause of heart failure. Acute decompensation. Acute decompensated heart failure. Chronic stable heart failure may easily decompensate. This most commonly results from an interrecurrent illness such as pneumonia, myocardial infarction, abnormal heart rhythms, uncontrolled hypertension, or a patient's failure to maintain a fluid restriction, diet, or medication. Other well-recognized factors that may worsen the congestive heart failure include the following: anemia and hyperthyroidism, which place additional strain on the heart muscle, excessive fluid or salt intake, and medication that causes fluid retention, such as nonsteroidal anti-inflammatory drugs and thiazolidinediones. Nonsteroidals in general increase the risk twofold.